You got some weird stuff going on today?
Yeah, like side of the family.
Got it.
That was good.
So, you got some weird stuff going on today?
Yeah, like obviously I've been here more frequently because I feel like my neck and my back have been more tight.
Right.
But I just randomly, like when I'm sitting down and stuff, I'll feel really lightheaded, like, and kind of nauseous. Like I feel like I'm gonna pass out. I don't have COVID.
When you're getting up?
No, when I'm just sitting.
When you
like,
just sit?
like doing nothing, and then I'll get like kind of this tight pressure in my chest, and I feel like it just kind of like radiates down my arms, and it just comes and goes.
Are you
like,
anxious?
No.
You don't feel anxious?
No.
Okay. Do you feel like this all the time? Every time you sit, or just really random
It's just very random.
times? Okay, and you haven't thought of like food? You don't feel like it's at times where you're super hungry or anything like that? It's just very random.
Yeah.
So your chest gets tight.
Yeah.
You get lightheaded
Yeah.
as soon as you sit down, and like almost dizzy.
Yeah, like I'm literally just sitting, like doing nothing, and I just get really lightheaded, and it kind of freaks me out, to be honest, because my chest gets super tight, and then I just get this really weird feeling down my arms.
Yep.
But then it
Both
like,
arms.
eventually passes. Yeah.
Lasts for a minute, a second,
A minute or so.
and then you just
Then
kind of
it's normal.
you stay seated, and then you get up, and you're
Yeah.
fine. Okay, you're not pregnant.
I swear.
Have a seat. Well,
But it freaks me out.
Yeah.
Because like my mom obviously, like she had a stroke.
how old was she?
She's like 50.
Yeah, and how old are you?
Young, obviously, 29. But and then my dad obviously has heart disease on his side of the family. But
Yeah.
like I had my physical done and everything.
Had some blood work
Normal.
done, and you did this since you started having those symptoms?
It was before.
Okay. Well, so obviously neurologically, your upper cervical and the vagus nerve can impact and could create symptoms like that. Of course, medically, you could go to that extreme,
Yeah.
but likelihood's very low for that at your age.
Right.
And so if symptoms continued, or like you were so freaked out, you could go to the medical doctor.
And I don't want to.
No, but I think it might be something a little bit more simple than that.
Yeah.
So we should just watch the upper cervical. It's called your parasympathetic nervous system. That would impact that mostly, and kind of skip the middle sympathetic nerve system, just so we really impact those.
Okay.
And just kind of monitor that a little closer.
Okay.
Scoot forward. You've been working out a lot?
Not a lot, no. Maybe
Okay.
like lifting weights like 2 times a week.
Okay. So nothing heavy.
I mean, it's heavier than what I've
Is it?
been doing just because, we don't go that often.
Yeah.
But, yeah. I feel like my back is, like, really
Tight through there?
too.
Yeah, in the chest and like in the upper back.
Yeah.
Mm-hmm.
And I can feel it kind of in my sternum.
Yeah, so I think there could be a lot of correlation to that. Got it. Clumped in there, didn't it?
Yeah.
Okay, come on up and we'll do your. Well, I'm gonna skip this one. We'll do muscle work there, but we're gonna go over here. Because again, I want to do your parasympathetic nervous system for the adjustments. So roll with me here. There you go.
That was good.
Hey guys, Dr. Hetland. I hope you enjoyed that video. I just wanted to explain what we were talking about in this video a little bit more. and the parasympathetic nervous system. If you Google that, you'll learn a little bit more about it, but basically some call the parasympathetic nervous system the rest and digest part of your nerve system. And so we decided to focus on that part of her spine. You could see from my examination that that part of her spine could use the treatment. So we adjusted her upper neck and her lower sacral area to stimulate a parasympathetic response. And Lindsay hasn't had any of these symptoms since she's been getting treated. And just an amazing testimony of what your body and chiropractic can do. So I hope you enjoyed that video. If you did, hit the like button and subscribe for more videos like this.